friends. This is Kelly Calabrese, and today I'm here with Dr. Jared Sharp from Idaho Equine Hospital in Idaho. Dr. Jared, thanks so much for being with us.
Absolutely. Thanks for having me.
Yeah, tell us a little bit about your clinic and what you do out there.
Yeah, we're a regional referral hospital located in Napa, Idaho. There's a group of 13 veterinarians, including our 2 interns. We have board certified specialists in internal medicine, emergency critical care, as well as surgery. And then a group of us that do sports medicine and routine general care as well.
Wow, that is fantastic. That's amazing. Thanks for all the work you're doing out there. So tell us how you heard about Renovo.
Actually, it was first client drove, which talking with you guys sounds like that's a lot of where this first stems. A client has a friend who says, hey, will you please, or had good success with Renovo and encouraged their friend to get their veterinarian to reach out, learn more, and decide if that was right for their horse as well.
Excellent. About how many horses have you used it on?
I would say I'm probably a dozen to a dozen and a half. So I'm still early on in my trials here, but I've been pretty excited with what I have seen. One thing I will say, and Renovo even mentioned that when the team was here visiting with us, at first we didn't really give it a fair chance because it was used on the horses that were refractory to everything else. Everything else has failed, so okay, let's try Renovo. And the ones I've been most impressed with is this just happened, an acute injury. Let's go all in and put Renovo in right now. And I've seen very, very impressive results in those cases. So it definitely case selection with anything, but like I said, maybe not a fair trial at the beginning. And I think that's probably true for a lot of us across the country. When there's something new, you often do the tried, true, tested that you're most comfortable with first and reach for something newer later. But that paradigm definitely has to switch as we move forward.
That is great perspective. Thank you for sharing that. Can you think about a case or two that maybe you could share that you've been impressed by the results that you saw?
Sure. One, I guess, that I am most impressed with is a fetlock joint that has a large fragment that our team of surgeons did not feel comfortable with any type of surgical repair. And Renovo has been used to manage that horse's joint inflammation and keep him sound and in the arena, which has been pretty impressive.
Wow, that's fantastic. How about one more?
Okay, so besides that first case, I guess the others we've reached for it in soft tissue lesions, which have been very rewarding. And I've put it in some, here I talk about another fragment or fracture, but I put it in a hock with the incomplete fracture of the central tarsal bone, which again did not need surgical fixation. However, the joint was inflamed and have been very impressed with that horse's results as well. And that partial or incomplete fracture of the hock is back to work and doing well.
That's great. So you're seeing horses that are getting back, would you say a little bit quicker? Or?
Quicker, and I think, those are 2 horses that don't have a clear cut, but are on the verge of needing a surgical intervention as well. And so that's pretty impressive when you're not requiring, or it's such a challenging case that there's not a great surgical approach, but that's the degree of damage that's present. And so to have something else to use in that case is very helpful. Excellent.
Have you used it in performance horses?
That is all I've put it in.
Okay.
Yep. And I've just ordered some. I'm gonna do my first horse's SI next week. So I'm excited. We always keep some in the freezer here and ready when we find our next case, but just because of the volume that I want to treat the SI with, I needed to stock up a little bit more. So looking forward to that next week as well.
Excellent. Well, we are happy to continue to ship it to you and keep your freezers full.
Absolutely.
What would you say to the veterinarians who have not yet tried Renovo?
I think it's a very intriguing product that has had very renowned or outstanding results. And some of the veterinarians across the country that I highly respect and look up to are also on this bandwagon. You know, this is not some low research, no backing product. I mean, there are some of the most highly respected individuals across the country, and it's being injected in some of probably the most expensive, highest performing horses as well. So I guess have confidence in the product.
Okay, well, that speaks volumes. Thank you so much, Dr. Sharp. We really appreciate your words here today, and we look forward to following up with you in the future to see how you continue to progress with Renovo in your practice.
Absolutely. Thank you for having me.
Thank you.